Hi, I'm Taylor.
I'm Catherine.
I'm a PA student also at Westfield State University, and today we're going to be doing our endocrine exam. I just finished sanitizing my hands. I'm going to grab the gloves. The purpose of this exam is looking for any physical manifestations of any endocrine-related conditions. So I have introduced myself. I've explained the purpose of the exam. I'm going to confirm my patient's name and date of birth.
Yep.
Confirmed, noted. And I just want to get consent, so I'm just going to let my patient know that this exam will require inspection, palpation, especially around the neck and the throat, the scalp. We'll be examining your skin, and I will be listening with my stethoscope. Is that okay?
Yes.
All right. So we're going to get started. We are inspecting the head. We're looking for size, shape, symmetry, looking for any frontal bossing or protrusion of the forehead, looking at the upper jaw, lower jaw for any maxillary or mandibular protrusion or prognathism. And then I'm going to look at the face, and I'm looking for any moon faces or rounding. I'm going to take a look at the eyes, and I'm looking for any exophthalmos, which I will use my light for. So just put this here. Why are you looking that way? Oh, because that's where the camera is.
Keep going.
Sorry, my bad. Okay. All right. Good job. Okay. And then I'm also looking for any periorbital edema at this time. I'm going to have you follow my finger, okay? I'm going to have you look up and then look down. And what I'm doing here is I'm examining for any lid lag. So what would happen is if the eye followed down, you would almost see like the lid not following like the same time. It would lag behind. And now I'm going to look for any lid retractions. What I'm going to do is I'm looking for any white sclera that shows above the iris, which we don't see. What else do I want to check on the eyes? Oh yeah, we're going to do bitemporal hemianopia. And so what I'm going to do is I'm going to have you cover an eye. I'm going to have with this eye to just look straight, lock in on me, okay? And then I'm going to cover the same eye. And I just want you to tell me if you can see my hand moving.
Yes.
Okay?
Yes. Yes.
All right, and now we're going to do the same thing with the other eye.
Yes. Yes. Yes.
Okay. I'm also going to inspect the face for any coarsening or thickening of the facial features, so any enlargement in the nose, thickening of the lips, or any macroglossia. So I can just take a peek at the tongue. All right, you can stick back in. And then I'm going to test cranial nerve 12. So I'm going to have you stick your tongue out again for me, and I'm just looking for any atrophy, deviation, or folliculation. I'm going to put back, and I'm just going to take a quick peek in the mouth, and I'm looking for any dry mucous membranes that would signal any kind of dehydration. Okay, next we're going to do the hair. So first I'm going to look at the scalp and the hair. I'm looking for any patterns of thinning or hair loss. And then I'm going to actually palpate the scalp and the hair, and I'm feeling for any brittleness, dryness, coarseness. And then I'm going to examine the lateral 1/3 of each eyebrow, looking for any hair loss in that area. And then I'm looking for any hirsutism or hypertrichosis. So that would be like body hair. All right, next we're going to move on to the neck portion. So first I'm just going to look at the neck, looking for any obvious signs of any masses, protrusions, or any asymmetry. Then I'm going to go over to the back, and I'm looking at the upper back, and I'm inspecting the cervical spine, and I'm looking for any dorsal cervical fat padding. I'm going to now palpate the spine, the cervical spine, and the cervical processes, paraspinous processes. Okay, and then I'm going to identify the trapezius muscle, and I'm looking for any atrophy or folliculation. Am I saying that right?
Fasciculation.
Fasciculation. All right, and now we're going to test cranial nerve 11. So what I'm going to do is I'm going to put a little bit of resistance on your shoulders, and then shrug up for me. Okay. Again, looking for any fasciculation or any like issues on one side with muscle atrophy or movement. Okay. Now we're going to move on to the thyroid portion of the exam. We will link another video below that'll have this more up close. You can tell this is my first time speaking on camera.
She's doing great. Everybody drop love in the comments. We'll have to turn the comments on.
Okay. So first we're going to look again. I'm going to have you swallow. Okay. Do you need water? Okay, you can ask your patient if they need water because sometimes it's hard to swallow when you don't actually have anything to swallow. But just making sure that the thyroid's moving and that it's symmetrical and equal. Now I'm going to find my landmarks. So I'm going to look for the thyroid membrane, or I'm sorry, thyroid cartilage, which is the spiny process, and then below that is the cricoid thyroid membrane, and then the cricoid cartilage. And then I can feel the tracheal rings, and I'm feeling for any tracheal deviation. And then right in here is the isthmus. I'm going to have you swallow. Okay. And then I'm going to have you turn your head one way for me. And I'm going to feel for the thyroid right in here. Oh, I'm going to use my thumbs. Alright. So I'm going to stick my thumb in here, and I'm going to have you start to turn your head. And so what I'm doing is I'm displacing the trachea so I can better appreciate the thyroid on my left side, her right side. So now I can palpate in here. I can palpate the posterior aspect of it. And then I can have you look the other way. Do the same thing. Palpate the posterior side. Sometimes small. That's okay. We'll do it in a minute. Okay. Then I'm going to listen for any thyroid bruise. Why don't you go ahead and explain some thyroid bruise?
Could indicate that you have excess blood flow. So it could be something like Graves, or it could be something like a malignancy.
Okay, now do you hold your breath? Okay. And how do you hold your breath as well? Okay, I'll let my hair out. Alright, so now we're going to move on with the rest of the exam. So I'm going to look at body habitus and skin. So first I'm looking for any signs of hyperpigmentation, especially in sun exposed areas, or pressure points like elbows, knees, the palmar creases. I'm also looking for hypopigmentation for any signs of vitiligo. I can look for velvety plaques for acanthosis nigricans. Sorry, my pronunciation's not the best. So that would be velvety hyperpigmented plaques, usually on like the back of the neck, in the axillary area, so we can check in there, and then in the groin as well, which we won't be checking for this exam. I can then look for pretibial lymphedema, so that would be a non-pitting waxy plaque on the front of the shin for that. Okay, I'm also looking at body habitus, and I'm looking for any central obesity compared to relatively thin extremities. I'm looking for any proximal muscle wasting. I'd be looking for any purple striae greater than a centimeter around the abdomen and flanks. So we just look for that. And then I would be examining the hands and the feet. So we'll start with the hands. First I'm looking at the nails, inspecting for any brittleness or damage. Then I'm going to look at the palms for any excessive heat or cold. And then I would look at the feet as well, and for the hands and feet, I'm looking for any acral enlargement. We won't take the shoes off, but we will look at them. Any questions? Okay, I think that's it.
Perfect.
Cool.